Some of the earliest signs of autism would be a child who does not make eye contact, a child who does not smile and engage in games like peekaboo, for example, a child who is fixated on what would seem uninteresting kinds or those kinds of activities that most children do not engage in. It might be a child who is always focused on the lower portion of the face, say, instead of making good eye contact with the parent. It would be a child in some cases who is very quiet, a very, very easy child or infant, or a very, very difficult infant or child. That would be another early sign. I would also look to something like play behaviors. Okay, children who are under a year, it's not unusual to find them mouthing objects, okay, or banging or throwing. That's really how children play. After a year, we look to see more functional play. So the child should pick up a brush or push a car, really knowing what the purpose of an object is. And then beyond that, symbolic play, which is a very, very important stage in play development. And so what we would want to see is a child who feeds a doll, a child who can demonstrate some caregiving routines or act out and engage in pretend play. So those are some of the things, if I'm not seeing those in a child, that would warrant some concern. And again, the younger we go, the more difficult it will be to diagnose. The less reliable is your diagnosis. There are some behaviors we would watch, and we may suggest this is a possible emerging autism spectrum disorder, but we could not be definitive.